All right, Tom, well, new at 10, not only are we seeing an increase of COVID cases, but flu season in Arkansas is ramping up, with some even testing positive for both viruses at the same time. THV 11's Ashley Godwin reports from the pharmacy at Wellington, where they are testing and vaccinating for both viruses.
The pharmacy at Wellington has seen consistent lines for testing and vaccinations against COVID-19 and the flu. Vaccinations are inside the building, and outside, people get curbside testing.
Yes, we're vaccinating a couple hundred people a day.
COVID cases are increasing at record high rates, but also flu season is ramping up as well. In Arkansas, we are seeing high levels of flu and other illnesses like it, leading to a battle of the viruses.
People who think they have COVID sometimes find out they have flu instead. So it's hard to say, which one it is, just based on symptoms alone.
Many of the symptoms are similar: fever, body aches, fatigue, and cough. Some even testing for both viruses simultaneously.
We see just a handful a day with that. It's not the majority of patients.
So having both would be additive, and that certainly would be much harder on the respiratory tract, as well as the inflammation and the toll that it would take on their bodies.
Dr. Jennifer Dillahay, the state's chief medical officer, predicts both flu and COVID will continue to increase in the meantime, but that could change if we take the right precautions.
It's possible that if people take the important steps of preventing the spread of COVID, such as masking and social distancing and staying home when they're sick, we potentially could see a decrease in the transmission of flu.
The Department of Health does not track flu like they do COVID-19 cases. They only track flu hospitalizations and death. So this year so far, we've only had one flu death. Last year, during a mild season, we had 24 deaths. In Little Rock, Ashley Godwin, THV 11 News.
Now, Dr. Dillahay says when you do test positive for COVID or flu, the key to making sure you're no longer contagious is to wait until your fever has been gone for 24 hours, plus your symptoms are going away.